The COVID-19 pandemic was one of the biggest pandemics in human history. The COVID-19 disease can be known as a non-border disease because it reached so globally with such a fast pace and on such a great scale. We see here that there are a few places that weren't touched by the pandemic. We see in this chart, we see the total vaccinations of the confirmed cases. So in Europe, we see a lot of individual countries. That's why we have a lot more dots. One thing we need to mention about the data used in this visualization is that it might be flawed. The actual total confirmed cases might differ quite a lot compared to the actual cases of COVID-19. Also, there were a lot of null values in the data. So we now have an understanding of the global reach of the pandemic and how fast-growing it was and how brutal it was. And unfortunately, this also led to a lot of deaths.
As Katarina pointed out, the rapid spread of COVID-19 has resulted in a significant number of deaths in various regions. It is on this basis that I'm going to talk about the average daily deaths per month. Before diving into the data, it's important to recognize its complexity. The figure we are about to discuss include not only deaths caused by COVID-19, but also those who die infected by the virus and who may have had other health problems. In February 2020, we saw an increase in the number of deaths, coinciding with the spread of the pandemic across continents. However, in February 2021, we can see a drop in mortality rate in all regions. This testifies to the effectiveness of the first effect of the vaccination campaign, but after we can see an increase again in the deaths caused by new variants of virus as data, but also because vaccine deployment has been unequal from region to region. Between August and October 2021, the average number of daily deaths fell considerably. This period corresponds in particular to the intensification of the vaccination effort worldwide.
We're now taking a closer look at a very uptelling graph which represents the total doses administered of COVID-19 vaccines. Let's start with 2020. Notice the straight line. That's because the vaccine was still under development and no doses were administered. When we move on to 2021, we can see that from May to August, there's a significant uptick in the graph. That's because the vaccines were rapidly being distributed to different regions. And we can also see in this graph that the Western Pacific region has the most administered vaccines, that's because of the population of that region. Before we move on, let's consider the inverse relationship of this graph with the death tolls of COVID-19. When vaccines go up, deaths go down. And in the next slide, we'll delve into how vaccine distribution evolved over time, highlighting the differences and challenges faced by each region.
In this analysis, we can see a graph that tracks the COVID vaccine doses that were distributed all along the different global regions from 2020 to 2021. As we started to navigate through the data, it's evident that the West Pacific region and Europe were the first to have the early access to the vaccine. And this is strongly correlated to the economic principle that says that the countries that has the greatest willingness are the ones that has the early access to the vaccine doses. It is quite striking to see the disparity between Europe and Africa as it is shown in the graph. In contrast, the graph shows a different story for Africa. The continent witnesses just a marginal increase on the daily doses, on the daily and monthly doses from the beginning of the 2021 summer. So the discrepancy is not just a number, it highlights the issue that the global health resources has in the world.
If we take a diver look into other regions of this graph, we can see that the Eastern Mediterranean is the second lowest region to have the lowest total number of vaccinations, or the lowest distribution, of course, following Africa. And we've associated this with the contributing factor that the Emerald region is home to religions that have a strong stance against vaccinations, and in effect would reduce the willingness to obtain or get vaccinated. If we come back to Africa and Europe, we could see the critical disparity by noting that in the latest bar for Africa, they have less vaccinations than they did in the earlier stages for Europe, indicating that in the initial phases, Europe got more vaccinations than what Africa has in the latest phase. And in terms of market opportunity, this shows that there is a critical demand for vaccines in Africa, and there is no supply to meet this demand. This is an opportunity for pharmaceutical companies or pharmaceutical suppliers because they should step in and take advantage of this critical need in Africa. And talking about pharmaceutical suppliers, we are now gonna go dive into Pfizer and how Pfizer was a key player into all of this and how other pharmaceutical suppliers are key players into the distribution of vaccines and lack thereof across regions.
Now what we have here are the different brands that were used for the vaccination of COVID-19 by region. The first insight that we can have is that AstraZeneca is the only brand that were distributed but in all of the region, having a considered market share in some of them. Furthermore, Africa has the lowest proportion, as we can see here, of the vaccine, and that's why we are going to be focused on that. And we can see now, we can notice that BBI-BP has the higher market share on that region, followed by Johnson. Additionally, when we have the Pfizer, there's no almost presence on that bar chart, and that's why we are going to know if Pfizer have presence on other regions. Well, we can appreciate that Pfizer is mainly focused on Europe, but there's other regions that is close to almost non-existent, and that's why our recommendation will be basically on how Pfizer can be target Africa market, because they will need more vaccines on that.